would like to welcome everybody back to our series on COVID-19 pandemic. Today, we will be speaking with Dr. Dana WIllis-Henderson about prevention measures and transmission of the disease.
This podcast is brought to you by Tuskegee University's College of Agriculture, Environment, and Nutrition Sciences, Tuskegee University Cooperative Extension Program, and Anchor FM. We're currently available on many platforms, including Apple Podcasts, Breaker Audio, Google Podcasts, Pocket Casts, Spotify, and Radio Public.
I would like to welcome Dr. Dana WIllis-Henderson. And Dr. WIllis-Henderson, could you please introduce yourself to the audience?
Yes, my name is Dr. Dana WIllis-Henderson. I'm currently the hospital administrator for Tuskegee University College of Veterinary Medicine, our veterinary medical teaching hospital. I joined the TU team in May of last year. Some other background for me before joining Tuskegee, the College of Veterinary Medicine, I've had the pleasure of having experience in different areas. I've done private practice in Illinois for a couple of years, in addition to working for the corporate veterinary industry, where I was actually what we call the regional medical director for the Midwest, which encompassed over 145 hospitals, over 11 states. So, and then in addition to that, I practiced in Las Vegas, Nevada as well. So for me, I've had a multitude of different areas in regards to veterinary profession, and very unique in the sense of private and corporate America. So in addition to now adding academia, which seems definitely a challenge, but it's definitely exciting to be here.
Why, thank you. One of the joys that I'm getting out of this is seeing how strong and diverse our faculty is in both the College of Veterinary Medicine and as well as some of our other biomedical and public health faculty. So thank you for joining us. So we're going to jump right in and start with the first question about transmission. How does this disease transmit between people?
Well, as we know now, we definitely know that it's transmitted through contact, secretions, respiratory secretions, in other words, from human to human, also through surfaces, which we call fomites, and that could be hard, porous, non-porous surfaces, which is most common, as well as, say, paper. I know people have concerns in regards to their boxes that are being delivered. So all of those things, anything that is a hard surface or non-porous is most susceptible to. So now when it comes to pets though, fur is considered porous. And so we cannot say that is not a way of transmission, but at the same time, it's really just from human to human.
There have been some concerns or discussions about some animals having been infected with the virus that causes the disease. Can you speak a little bit more towards that and kind of give some clarity to the topic?
Absolutely. I believe the most recent incident was involving a tiger in the Bronx Zoo. And come to find out, it was additional ones that were also involved, that the zoo caretaker who was shedding the virus at that time is believed to have spread it to a Malayan tiger, I want to say Zur tiger, as well as African lions. And so with that, they were showing respiratory disease, just a dry cough. Some had some wheezing, others just had mild anorexia. It was expected for them to recover. based on that. But right now, none of the other animals within the zoo have shown any signs of respiratory disease or being positive for COVID-19. That being said, more studies because of this have come into the forefront to see, is there any possibility of this transmission from animals to humans? And right now, we just do not have evidence of that. At this time, we're still saying, hey, at this point, please be very cautious, still follow CDC and WHO guidelines in the sense of good hygiene, making sure if you are ill or you have signs to separate yourself from your pets, just like you would any other person or someone in your family at this time.
So the best methods of not transmitting the disease between pets, animals, and or humans, we will be following those same social distancing and protective measures that the CDC has requested.
Yes, correct. Yes, 6 foot social distancing, just as you would. At the same time, we're not saying don't touch your pets. Definitely can pet them. We're saying maybe not. Make sure you're not sharing their bowls, especially as we like to hug on them, kiss them. We're saying let's limit that at this point in time. We're not saying that you cannot have them around you or any of that nature, or taking them out for walks. Those are perfectly fine. It's just reducing the contact in the sense that you are kissing them, hugging them. You also, when you're handling all of their bowls, making sure that you're washing them on a daily basis. Those types of things that are good hygiene moving forward. We do have certain pet owners that actually they have service animals, so they are utilized and have to be with them all the time. So we are asking them to take even more cautious, take more precautions in the sense of because they're the only ones handling them. And if they are sick, that you definitely need someone else to take care of them while they are recovering from the illness, if they are positive or showing signs. Also important, if you feel that you need to wear gloves, definitely doing that as well. So all those things are important at this point. We do know that having pets is actually, we build that human animal bond. And we do know that research states, and there is evidence that having pets actually helps with stress, reduces anxiety. So this is a good time that having pets is very positive in the family home. So taking that, and I know a lot of pets too are probably realizing, hey, things are different now. Why are you home more often? So you have some pets that are really going to embrace that, and then you have a few that maybe are probably going to have anxiety for themselves because they're like, why are you home? So that can go both directions. So I would say definitely, if you have any questions, please call your veterinarian and ask questions of what you should do if you notice different behaviors within your pets, but also embrace it, because we have shown that it is helpful. And for your kids, having them to take the pets out because they're inside all the time. So this will be a good time for your children to be able to go outside, get some air, and get some exercise as well. So it can definitely be a positive of being home and having pets as well, but still taking those precautions that we discussed earlier in the sense of good hygiene.
All right. Thank you again, Dr. Willis-Henderson. Thank you for helping to leverage the strength of the programs that we have at Tuskegee University to actually provide some usable outreach for our citizens and our surrounding community. I would definitely want to thank you for that. And we would actually like to have you back on the podcast, not just for the pandemic, but, when we start to talk a little bit more about pets and animals in the times when we are beginning to heal.
I would also like to direct you to the Tuskegee University resource website, which is www.tuskegee.edu/coronavirus. You should also look at Alabama Department of Public Health's website, or whatever website for the Department of Public Health for whatever state, or country you may be in, and also the CDC website for coronavirus. Information is consistently updated, and you can bet that this is the most current and most factual information. But stay tuned as we learn things new every day.